Ankle replacement is where we replace the ankle joint with metal and polyethylene, which is basically like a plastic spacer that acts as the joint space. Ankle replacements are not as common as hip and knee replacements, which are more commonly talked about, and more patients get hip and knee replacements. Ankle arthritis is more commonly a result of trauma to the ankle in the past, or because of a deformity that a patient has had since they were younger, or that they have developed as they've gotten older. And ankle replacement is an option for patients who are usually about 50 and older and have some limitations in their activity because of their ankle arthritis, and have pain because of their ankle arthritis as well. So patients who have ankle replacements are oftentimes immobilized for about 2 weeks where they're not putting any weight on their ankle. And then after that, they do start to put weight on their ankle in a boot. And then patients work with physical therapy just like they would with any other joint replacement, and work on getting the ankle moving. The biggest predictor of range of motion after surgery is range of motion before surgery. And so patients maintain that motion, as our only option in the past for ankle arthritis was to do an ankle fusion. And so the ankle replacement actually still allows the patient to have motion of their ankle. And patients can really do activities that they want to do afterwards in terms of skiing, hiking, biking. We really don't want patients to run after a total ankle, and so that's more limiting in that sense, but they are able to hike, they are able to walk, and they can cycle and do some of those lower impact activities.